Hi everyone, welcome to your first ultrasound class. I hope you are super excited to get going. You probably have a little background information on ultrasound and some of the basics from your orientation to medical imaging course. And if you've done a little bit of personal research on your own time, that is all great. This first course that we are going to be taking, this Foundations to Diagnostic Medical Sonography class, is really going to lay the groundwork for your skills to flourish once you start the clinical semester in the spring. So we're going to be spending a lot of time in the lab. We're going to really kind of get your basic skills ready to go so that when you do enter into the clinical world, you're not going to be so overwhelmed by everything that's going on around you. So this class can be a little bit intimidating if this is all so foreign to you guys. This is really going to be like learning how to read, learning how to ride a bike, learning a new language. It's all something that's brand new to all of you. So this is something that you shouldn't be hard on yourself. Everybody learns differently. There are different ways to teach this material. So if you're not understanding how I explain something one way, please, please, please do not hesitate to reach out to me and ask for a different explanation or a way to remember some of these topics. So we're going to get into just some of the basics of ultrasound and the profession of ultrasound in the healthcare world. There are some basic terms that we have to talk about really briefly as we go through these lectures and these PowerPoints. You're going to be hearing a lot of these different words, and we need to make sure that we understand the differences and the similarities between these words. So we're going to be talking a lot about acoustics, and this is something that's going to come up a lot in the spring when you take your physics course. The whole principle of ultrasound is based off of sound, and we reference that in terms of acoustics. So this is going to be the study of science, engineering, and the art of generating, propagating, and receiving sound waves. That's all just a fancy way of saying that we're using sound, we're manipulating sound in a way that we can be able to look at the internal structures of the body. Ultrasound, as we know, this is giving that blanket term to sound frequencies above the level of human hearing. So anything over 20,000 hertz is going to be something that we cannot hear. That's where we're going to fall into the ultrasound technical world. So anything above that 20,000 is where we're going to be operating. Diagnostic medical sonography. This is going to be, again, another blanket term that we use to describe the technique of looking inside of the body and looking at structures that are internal. A sonogram is the type of examination that we're performing. So these are the images that we're taking per exam. There are dozens of different types of sonograms. We're going to learn all about them this semester. You're going to see them. You're going to be performing them when you start clinic in the spring. But an actual dedicated exam, depending on the clinical indication, is referenced as a sonogram. We don't typically use that word too much. We kind of just say exam or procedure or test. A sonologist is going to be the physician who interprets the ultrasound study or the sonogram itself. Typically, that person, that physician, is going to be a radiologist. Now, a radiologist is a physician who really reads anything in the radiology world. So they're looking at x-rays, they're looking at MRIs, they're looking at CAT scans, at nuclear medicine studies. But some radiologists are more specified. So they may only read CT scans. They may only read ultrasounds. So if you have a radiologist who specializes in ultrasound, we can refer to them as a sonologist. Now, a sonographer is who we are hoping to be. You are the technologist who's performing that sonogram or that ultrasound study. We do not refer to ourselves as technicians. That should be something that you are very aware of from your orientation to medical imaging course. We are ultrasound technologists or sonographers. Now, sonographer is usually a term that a lot of people don't recognize. They don't really know what it means. They may not have heard of it before. So you'll frequently hear people referencing themselves as ultrasound techs. Just be aware that it is an ultrasound technologist, not a technician. We do have some organizations that we have to talk about. We are going to be kind of bouncing back and forth with these organizations as we move through the program. The ARDMS, this is our big, important governing organization. This is who we report to. This is who we have to pass their exams. We have to maintain our credentials through them. So the ARDMS is something that you are going to hear from now until the end of your career. This is the American Registry of Diagnostic Medical Sonographers. They are responsible for cultivating and proctoring the national exam that you take at the end of your education to become a registered technologist. Now the STMS, this is something for when you are a professional in the field already. They do have some student accounts that you can sign up for, but this is a Society of Diagnostic Medical Sonography. They are responsible for making sure that our professional practices are up to code. So we have a code of ethics that's created through the STMS. We also have the AIUM. This is the American Institute of Ultrasound in Medicine. This organization is responsible for creating protocols and regulating the quality of images and exams from medical facilities. So every medical facility that is accredited, meaning they want to be recognized as a top-notch healthcare facility, they have to abide by the regulations and the protocols of the sonograms and the exams set by the AIUM or the ACR. Two very similar organizations. So ACR, American College of Radiology, a little bit more broad than the AIUM. They are also going to be responsible for creating and regulating those scanning protocols, and again, that image quality assurance. So on a pretty frequent basis, facilities have to submit exams that have been performed in their facility to either the AIUM or the ACR, whichever organization they're accredited through, and they have to wait for approval on those images. That approval process basically says, yes, your technologists are operating in the protocol that we expect. They are operating and performing high quality images. You can continue on doing what you're doing. Or they may turn around and say, your facility needs more work in this type of exam. You need to reevaluate this type of protocol that you have been submitting and implementing with your patients. So both very important organizations in terms of consistency of patient care and consistency of ultrasound expectations across the board and across the nation. We also have the ARRT. This is not something that we typically use too much in the ultrasound world, but this is the American Registry of Radiologic Technologists. This is the national organization for radiography students, but they also have this new ultrasound exam that you can take through the ARRT. It does allow you to be a working ultrasound professional, but it is not the best standard to use. The ARDMS national exam is going to be the gold standard of what we want our students to be taking and passing and becoming in terms of professionals. We're going to talk a little bit about some credentials, so we'll come back to the ARDMS and the ARRT in a second. Now, the sonography profession in and of itself, this is a multi-specialty field. So this means that, yes, we're going to get our education in ultrasound, but we are going to further specify what that means. Unlike X-ray, we have a lot of specialties where we can go and further our training and our knowledge and our credentials. When you go to MRI school and you take your MRI registry, it's pretty much one and done. You have passed your education, you've passed your exam for MRI, and now you can just go work as an MRI tech. That's not the same for ultrasound. You can't just pass your program, pass your abdomen boards, and then go work in an OB/GYN office. It doesn't work like that. So we further specialize the different areas of ultrasound in terms of examination, credentialing, and abilities. So diagnostic medical sonography, the specialties that go with that broad topic are going to be abdominal, OB/GYN, breast, and then not really recognized as much as those first three are going to be neurologic and ophthalmic. Those are sort of supplemental credentials that you can get once you already have your abdominal or your OB/GYN specialty. So we're not seeing a lot of neurologic or ophthalmic ultrasound credentialing. It's also something that in terms of the healthcare world is starting to move away from. There are other types of medical imaging exams that can give us answers about neurologic conditions and ophthalmic conditions without having to use ultrasound. So the bread and butter of the DMS specialty is going to be abdomen, OB/GYN, an additional of breast, and then a few other categories that we're not seeing too often. Our program is credentialed or accredited for abdominal and OBGYN. So at the end of this program, actually prior to the end of this program, you will be able to sit for either your abdominal or your OBGYN registry, and you'll be able to work in those types of ultrasound facilities. Now, we don't offer these programs at LSMI, but I will touch upon them in a second. Diagnostic cardiac sonography is something that is in a different world from radiology completely. So although it is a type of ultrasound, they are looking at the heart, and that is in terms of the adult heart or the pediatric heart. These technologists, they work with cardiology. So us as ultrasound technologists, we're working with radiologists. Echo techs or diagnostic cardiac sonography techs are working with a cardiologist. So we operate in two different departments of the hospital. We operate in two different types of offices. So we're not really going to be working with any echo techs or echocardiography technologists. They are in their own little world. It's a different type of education. It's an entirely different schooling, different registry requirements, and really working in a different kind of healthcare environment. Now, vascular technology in some aspects is its own type of education. There is another program in the state that offers a specialized vascular technology program, but here with our program, I made it an important aspect of adding this to your education. So although we are an abdominal and OBGYN accredited program, you will still learn all of the encompassing information of vascular technology. You will learn how to image the venous system, the arterial system. You will learn how to perform some of those interventional exams and those vascular testing exams that are done in that vascular world. So vascular technology is sort of the bridge between DMS and echo or cardiac sonography. Vascular technology is something that we're still able to do and become credentialed in as DMS students, but it reaches into that cardiovascular world where echo techs are looking solely at the patient's heart. Vascular techs are looking at the peripheral vascular system. So we're looking at the arteries and veins of everything else in the body beside the heart. So a little interesting relationship between the three types of ultrasound out there in healthcare. Now, with vascular technology itself, you do have to be aware that it is a little bit more interventional and invasive than DMS is. We do some procedures in DMS, we do some GYN procedures, we do some abdominal procedures, but for the most part, those are pretty minimally invasive exams where we may go in and take a tissue sample, we may be doing some biopsies of patients, but we're not cutting people open. We're not, really experiencing that invasive aspect of healthcare. Vascular technology is a little bit more involved than that. There are a lot of invasive vascular procedures that need the assistance of ultrasound. So those technologists are going up to the OR quite a bit. They're maybe working in an outpatient surgical center performing vascular exams. So if that's not something that you are interested in, may have a weak stomach, that's something that you're going to have to think about as we move forward. We also do have additional registries. These are a little bit newer. So we have the pediatric credentialing and examination and the musculoskeletal. We touch a little bit upon these two topics in the program. We actually talk quite in depth about some pediatric exams, but musculoskeletal is so new that it's something that's a little bit slower to catch on. So as we move through the program, we may be seeing more and more of that MSK or that musculoskeletal type of ultrasound. So credentialing, like we said, you can get this either through the ARDMS or you can get this through the ARRT. With this program, you are expected to take the ARDMS exam. We set you up for taking the ARDMS exam, and we've had great success with this. I will say that the ARDMS exam is going to be much more challenging than the ARRT exam, but that's because it's recognized more highly by employers and by healthcare facilities, especially in our local community. So certification is going to be required for us to work. Previously, years back, we had the opportunity as new grad students to work for up to 2 years before becoming fully registered. They've recently taken that possibility away. So you have to be fully registered before a job can even be offered to you. And that makes it a little bit harder for us in the ultrasound world because unlike X-ray, MRI, nuclear medicine, we have to take 2 registries to become fully registered. It's not a one and done for us, and it really isn't even a 2 and done for us. We're always going to be having to take more registries, become more credentialed to be able to work in a wider variety of facilities. So what do I mean by saying we have to take 2? You have to take an entire dedicated physics registry before you can even decide what type of specialty exam you want to take. Like I said, through this program, you can take either abdomen or OBGYN. I've really had a mix of students who take between the two, so it's not really one that we lean more towards or the other, but you have to take your physics and pass your physics registry first before you can schedule your abdomen or your OBGYN registry. Once you take your physics and pass, and then you take your abdomen or OBGYN and pass, then you are considered RDMS. You are considered a registered diagnostic medical sonographer. Once you have that, you can then add on credentials. You can go and take your breast, you can go and take your vascular exam. If you take and pass the vascular exam, you get additional credentials of RVT. Because like we said, vascular technology is in its own little world, just like echo is, but it's more closely related. It's more attainable for us as RDMS to have RVT. You don't really see anyone with RDMS go and become RDCS, right? Registered Diagnostic Cardiac Sonographer. Echo is in its own completely different world. Vascular is the bridge between the two. Oh, and here, sorry, I'll just go back here really quickly. So here is an example of what the testing centers look like. We do use, actually the AirDMS uses Pearson VUE testing centers. You may have taken exams in these facilities before, but it is very strict. It can be very overwhelming. It can be very nerve-wracking. And I really do put emphasis on you guys preparing for these exams throughout the program. I test in a very similar fashion that the registries will ask you questions in. I really make sure that you are fully prepared and that your nerves are not at the forefront of your mind when you're going in to sit for these exams. With the physics exam, you are also able to take that as soon as you pass the class next spring. And that's actually a requirement of the program now. You have to at least attempt your physics registry prior to the start of your last semester in the program. So next spring, you'll take your physics course. Once you pass your physics course, you'll be able to schedule your physics exam. You'll take your physics exam, and you'll already have one registry done prior to even being close to graduation. Now, in your final spring semester, you can take your abdomen or your OBGYN exam 60 days prior to graduation, which is a great time for you to be taking it and becoming fully registered. You'll be in clinic for those last few weeks, hopefully at a site where you want to be getting a job at, and you can say to them, hey, I passed my abdomen boards, I'm fully registered, do you have a job to offer me? So this is all a long-term process, and it all requires steps taken to get there. So kind of just recapping what I had just sort of blabbed about for the last few minutes, what registries are related to what credentials, or what specialties are related to what credentials? RDMS, like we said, Registered Diagnostic Medical Sonographer, this is our world. This is going to be abdomen, OBGYN. That's what our program is accredited in. We also can take breast and pediatric as an add-on, but we wouldn't get any additional credentials within this category. If we were to go to school for echo at some point and we were able to take that echo exam, pass it, we would then gain the credentials of RDCS, Registered Diagnostic Cardiac Sonographer. If we were to take our vascular exam, we would add credentials of RVT, Registered Vascular Technologist. And if we were able to take the musculoskeletal exam or the MSK exam, we would obtain our MSKS. So these are all sort of attributes to that alphabet soup, like we had said back in the orientation class. So our role of ultrasound in healthcare, this should not come as a surprise to any of you guys. I'm hoping that you've done a little bit of insight or a little bit of research into this career, hence why you're so excited to start. But there are great pros to this profession. It is a fast, easy to tolerate procedure for our patients. It is highly accurate. We have a 2 millimeter margin of error, which is just phenomenal, meaning anything smaller than 2 millimeters, so in that 1 millimeter range, is where we lose some of our detail. So think about how small a millimeter is. We're seeing everything that can be bigger than that. We're not using radiation, so we don't have to worry about bringing ultrasound to the patient's bedside. We don't have to worry about using radiation with a pregnant woman, with a child, using it in the OR with everybody exposed to that radiation. We don't have any biologic hazards that have been researched with the use of ultrasound. I know there's some controversy out there. There are some sort of mommy bloggers that we see quite a bit of that are convinced that ultrasound can have bioeffects on their baby. That is certainly not the case. We will learn in our physics course the one potential side effect that can happen with ultrasound, where we get little pockets of heated tissue inside of our body, and that would be if we were to leave the ultrasound machine on its highest power setting on our body for a week straight. Now, of course, that's never going to happen. So there are no proven biologic hazards by using ultrasound in the clinical environment. It's pretty cost effective. So the price of an ultrasound is a few $100s. The price of an MRI is a few $1,000s. It's easy for patients to tolerate. Like we said, we can be creative with this. So if our patient can't move in a certain way or they can't rotate in a certain way, we can be creative with how we obtain our pictures in response to that. It's portable, meaning we can take it anywhere in the hospital. We can take it to nursing homes. We can throw the ultrasound, not throw, but we can put the ultrasound machine in our car if we're a travel tech somewhere. And it's easy for us to be able to diagnose conditions in live time. So if we're looking at a vascular condition, we can see what's happening with that vein or with that artery while it's pulsing, while it's occurring. So it's extremely fast, reliable. There's not enough that we can say in terms of good things with ultrasound. It really is becoming more widely accepted. So the role of the sonographer, like we have kind of touched upon in this pre-lecture and then our previous orientation to medical imaging course, there are a lot of requirements with being a great sonographer or being a responsible sonographer. So the term itself means someone who draws or graphs with sound. So we are performing an art with ultrasound. We are using these studies to help us get information to be able to provide to a physician or a radiologist to help guide in a diagnosis for our patient. We need to know how to use this equipment. We need to know how to manipulate this type of technology. So we have to be really academically qualified. We have to have very strong clinical skills in order to provide high quality diagnostic exams for these patients. We also have to make sure that we're using our available resources. We have to work smarter in this profession. We also need to be able to evaluate a whole slew of data while finding what's important and what's not. Sometimes our patients will come in, they will give us an extensive patient history, and we have to figure out what is clinically relevant for this exam and for this patient in this moment. We have so many old patients who come out and they say, well, it all started back in 1965 when my wife made me a balloon. It's craziness. So we have to be the ones to say what is relevant going on with this patient right now. We have to have critical thinking skills. We have to have executive decision-making functional skills. We also have to be able to interpret what we're seeing with our images. We have to give a oral or a written report or interpretation of our findings to our radiologist. So we are the first set of eyes as to what is going on with our patient in that moment. We are the first person to know if somebody has cancer. And that's a lot of weight on our shoulders, and that's a lot of responsibility for us. So we need to know that we are going to be able to find that cancer and act accordingly. We also are responsible for providing general information to the public. So we are supposed to be healthcare role models for our patients and basically be giving them the rundown of what their healthcare looks like when they're with us. We're explaining to them what the exam is, why they're having this exam done, what that process is going to look like, and we're allowing our patient to make informed decisions based off of the information that we're giving them. So some personal qualities that you have to have in order to be a successful sonographer. You have to be intellectually curious. As we saw in our previous slides, there are a number of exams that you can and should take as a professional. We don't just want to take the physics exam, one specialty exam, and call it a day. You should want to be taking more exams. You should want to be furthering yourself and your skills and your education. So you have to be intellectually curious about new and up and coming things that are happening in this profession. You have to be smart. Plain and simple, you have to have a strong scientific knowledge background, and you have to have a solid skill set. That does not just come easily to somebody. Even if this is something that you catch on to very quickly, there is still the entire academic component of this program and taking exams and being a knowledgeable sonographer when you're in the profession. So it is equal parts being able to do the skill and having the knowledge behind that skill. You have to have a desire to help people. You should not be in healthcare if you don't want to care for people. And this is for all people, all ages, all races, all abilities. Every single person that comes into your environment, you need to be able to care for them and help them. Now, that's not to say that we have to tolerate abuse from patients. We'll talk about that a little bit later on. But you have to want to help people. It's very unfortunate that I see in a lot of healthcare departments some techs who are maybe just so burnt out by the system that at the end of the day, the patients are just a number to them. I never want that to be you guys. You always have to think of your patients like your mom, your sibling, your friend. You cannot lose that desire and that empathy in terms of helping people. You also have to have the eagerness and the perseverance to obtain high quality images. Like I said, this does not come easily. This is like learning a new language. There are going to be bumps in the road. You are not going to be able to just click it in terms of getting your hand skills when you're scanning. This is something that you have to work at. I can't do this for you. I literally cannot hold your hand to be able to obtain high quality images. And it can be frustrating as a student because you feel like you don't know what you're doing. You feel like no one is there to help you. You feel like it's never going to make sense, but it will, and it does. And that is something that I can promise to you guys throughout this program. It's going to be overwhelming, but you have to persevere through those hard moments. You have to want to be able to do this for yourself. You also have to be able to accept and implement feedback. This is not something where everybody gets a trophy for participating. This is not something where everybody gets a sticker for doing something good. This is something that you are going to feel down in the dumps about probably a few times. And that's just the nature of working in healthcare and learning a new skill. I am going to be providing feedback to you constantly. And feedback is not criticism. Feedback is to help you get better. You have to be able to take it and change what you're doing, because that feedback is what is going to help you obtain those high quality images. I do not expect anyone to come in here and be able to know how to do anything. I don't expect you to know anything. I know we're starting from scratch. We're starting from square one. So you have to be able to take feedback, take it graciously, and move forward with that feedback to get better. You also have to be able to think quickly and have really strong analytical skills. You are going to be put in a lot of scenarios where you may be working by yourself, not as a student, but as a professional. You may be working by yourself and you have to make a split-second decision with your patient. You have to be able to have your background knowledge in those moments to say, I'm going to make this decision because of this. So that's a very overwhelming thing to have, especially when you're first starting out in this profession. You, like we said previously, you have to have critical thinking skills, you have to have the technical ability, you also have to be in good physical health. This is an extremely physical profession. When we move through the class this semester, we're going to learn quite a bit about ergonomics and how do we preserve our physical health with this really rigorous profession. We are standing, we're lifting patients, we're rolling patients. We are under a lot of physical stress. There is a lot of hard work that goes with this. And I've seen a lot of technologists sacrifice their bodies and sacrifice their physical health in order to get great high quality pictures. And the two don't have to be isolated from each other. You can maintain your good physical health and get high quality images. And I'm going to teach you guys how to do that throughout this course. You also have to have self-direction and the ability to make independent decisions. Like I said, a lot of ultrasound techs are working alone in departments. You have to be able to rely on yourself. You also have to have emotional stability. Like I said previously, we are the first person to know that our patient has cancer, and that is a lot of weight on our shoulders. We are the first person to know that a mom is having a miscarriage. These are really stressful and overwhelming situations to be in. Not only do we want to act in a human way where we want to provide support and empathy and kindness and love to our patients, but we have to be professional in those moments as well. And those situations can really test us, especially depending on the state of our patient. So you need to make sure that you are able to process these things independently and that you're doing what you need to do for yourself to remain emotionally stable. You have to have great communication skills. You also have to have great written, grammatical, and oral skills. We are writing preliminary reports for our radiologist. So if you don't have basic grammar skills, then we need to kind of take a step back and say, okay, we have to maybe do some sort of online learning or training for that. We don't want to be misspelling things. We don't want to be writing out sentences how we speak. We need to write in a professional manner. We need to speak in a professional manner. We also need to know how to communicate with patients, coworkers, and physicians, because those all come in at different levels. You don't want to speak to your patient like they don't know what you're talking about. You don't want to speak to your patient like they're dumb, because think about when you're a patient. Do you like when a doctor or a nurse talks to you like you have no clue what's going on? No, you like when they talk to you like you're a human being. So you are going to make sure that you have great communication skills with every single person that you come in contact with. You should speak to the cleaning staff the same way that you speak to a radiologist, and that is with respect and professionalism. You also have to work well with the team. So a lot of departments are really large and you're going to see a lot of different personalities. You have to be able to adapt to all of those different personalities and be able to work together and support your teammates. You may be having an off day one day, but you want to be able to rely on your coworker to help you through that day. Your coworker then may the next day be having a rough day, and guess what? Now it's your turn to pick up the slack for them. It's never a battle between coworkers. Some days someone's just having a rough day and you should be there to help them, because when one day you're having a rough day, you're going to want them to help you in return. You also have to have dedication to this profession. This is something that is constantly changing. If you feel like you are getting burnt out by this profession, or you're getting overwhelmed by this profession, or there's too much change happening, then that's something that you down the line are going to have to look inward and say, what am I doing here? Why am I here? And the answer to that question should be because you're helping people and you're changing people's lives. So always remember that even when times get tough, as you go through this program, you are going to have moments of doubt because it is challenging. This is something new. This is something that's really hard. You also may hear some students in other programs, oh, everything is great. I'm loving everything. Classes are easy. Classes are great. Clinic is fun. That's not the reality for us in ultrasound. I try to make everything as fun as I possibly can. We do a lot of great activities. We do a lot of team building activities. But the nature of ultrasound is that we are harder than the other modalities. You are the physician's first set of eyes on a patient. If you miss something, that patient's life could be ruined. That patient's life could be over. And that is a responsibility and a weight on our shoulders that the other modalities don't have. Not to say that those modalities are not important or not as important as we are, but in terms of technical responsibility, we are a step beyond that. So moving into some legal terminology, some legal issues that we want to make sure we're avoiding in the ultrasound world. This is something that you will probably cover in your MEDI or your Intro to Medical Imaging course or your medical terminology course, but just a little refresher here. We want to always be aware of the patient's right and the patient's autonomy to choose what they want for themselves. So if we are ever in lack of compliance with that, we could be facing these medical legal issues. So assault is going to be if we were to threaten or unsuccessfully attempt to hurt our patient, either causing fear or immediate harm. That would fall into the category of assault. Battery is when we have unlawful touching of another person directly or with an object. So even our transducer, our probe, that is that object that can result in battery. False imprisonment, either holding or detaining a person against his will. If a patient wants to leave our room, they have every right to leave our room. We should never be putting restraints on a patient. Restraints are actually a medical prescription that have to be prescribed by a physician. So anytime you are working with a combative patient, maybe in an emergency room, and they have restraints on them, you are never able to take them off. You are never able to put them on because that's false imprisonment. Also have negligence, so failure to perform and act in a reasonable manner or amount of time to fulfill the expected standard of care. So unfortunately, some departments are so busy and they're so short-staffed that patients can be waiting out in the halls, either before their exams or after their exams. And there have been situations in this local area, in not even just ultrasound and other types of imaging modality departments, where patients have actually passed away in the hallway after an exam waiting to go back to the emergency room because they were unassisted and nobody paid attention to them and nobody acted in a timely manner to get that patient back to their room and give report to their nurse or their staff. So that is an awful reality of negligence, especially in hospitals that are overrun and understaffed. We do have to follow a code of ethics. We kind of briefly touched upon this earlier when we were talking about the organizations that we report to. So ultrasound technologists, we are expected to practice according to the code of ethics that are set by the STMS. So this is something that we reference as our scope of practice, meaning anything beyond our scope of practice, we are not able to perform. We're not able to take a scalpel and do surgery on a patient. Right? So that is outside of our scope of practice. But anything inside of our scope of practice, we are responsible in terms of acting accordingly with our patient. So the goal of having a scope of practice or a code of ethics is to help us promote excellence in patient care by fostering the correct responsibilities and the accountability amongst sonographers. So this is basically saying that within this range of skills and knowledge, you should be acting accordingly and timely with your patients. Code of ethics principle number 1, you can take your time to kind of read through this, but basically we're going to be promoting patient well-being by performing all of these bullet points here. We are respecting the patient's right to choose and right to refuse a procedure. We are providing education in a non-judgmental and non-discriminatory manner. We are promoting privacy and comfort of our patient. We are protecting their confidentiality. Really kind of just an all-encompassing principle here. Make sure you take the time to read these bullet points. Same thing with principle number 2 here. This is a little bit more about us as the professional on our end. So this is saying that we are taking all of the steps necessary to be able to have the highest skill set possible, meaning we went through an appropriate education, we are practicing under the correct ultrasound credentials, we are following professional standards, we are following legal standards, we are following our continuing education requirements as a professional. So this principle 2 is talking more about what we have done and are doing on our end in terms of being a compliant professional in the healthcare system. And principle number 3, this is talking about personal integrity, being able to instill public trust with us because we are going to act with integrity. So this is more about our morals and making sure that we are really avoiding any situation where our patients are going to be compromised. And our scope of practice, this is a direct quote from the STMS. So the diagnostic ultrasound professional is an individual qualified by professional credentialing and academic and clinical experience to provide diagnostic patient care services using ultrasound and related diagnostic procedures. The scope of practice of the diagnostic professional includes those procedures, acts, and processes permitted by law for which the individual has received education and clinical experience and in which he or she has demonstrated competency. So this is an all-encompassing statement that is briefly touching upon those 3 principles of the Code of Ethics that we just went through. So it's basically saying that we are going to be following all professional standards in terms of our skills. We are going to be following all legal standards set by the law. We are going to make sure that we have integrity with the way that we are operating ourselves on a daily basis and how we interact with our patients. So just kind of wrapping up here, we kind of touched on a lot of different broad branches of ultrasound, and we tend to be sort of the end point for a lot of diagnosis. So we have a very similar job to detectives. We use evidence to help us come to a conclusion. We use patient history. We use a patient's medical chart. We are relying heavily on lab values. We're looking at all of those things. We interrogate our witnesses, which is when we are actually scanning our organs and our vessels. So we'll be looking at a patient's liver going, are you the problem? Or then maybe we'll look at the kidneys and go, are you the problem? And then maybe we'll look at the pancreas and go, wait, no, you might be the problem. So we're interrogating our witnesses while we're actually performing our exams. We track our clues, so we're looking for changes in anything of that normal appearance. When we start learning about specific organs, we're going to learn about what looks normal, and then if something doesn't look normal, does that fall into the category of an abnormality? So everything that we do in ultrasound is in comparison to a normal appearance. So we're looking for changes in that appearance. We then can identify the culprit, so we can find out where that problem is coming from. We can get the answers necessary by using all of that previous information to help us. Here's our nice little chart helping us get right to the diagnosis for our patient. So coming up throughout the next few weeks, we are going to be talking a lot about ultrasound specific terminology. You're going to hear words you've never heard before. You're going to have to spell things that don't make sense when you're spelling them, and you're going to have to pronounce things that you have no idea how to pronounce. We're also going to be learning about image orientation. How can we manipulate our image? We're going to be learning about image characteristics. So how do we describe our images? We're also going to be learning knobology. So this is going to be when we learn what each of those buttons on the machine do, how we adjust them, when we adjust them, what does that do to our image, and what is the importance of those buttons or those controls. Call it knobology because the buttons are all knobs. And then we're also going to be learning about ergonomics. Once we get through these main topics, we're then going to take all of this information and we're going to apply it to each specific organ. So we're then going to learn about how we look at the liver. What should the liver look like? How does the liver behave? When it doesn't look normal, what does that mean? So we're going to take it organ by organ in the second half of the semester, and we'll also be spending quite a bit of time in lab getting that knowledge internal so that you have a good foundation prior to starting in the spring scanning actual real patients. And how are you going to be successful in this program and in this class? It all starts right now. This may seem like an intro class, this may seem like a class that isn't important, but I can tell you that the success that you have with this class is going to foreshadow the rest of the program. Everything that we do is going to build upon the skills that you are learning in this course. If you do not take this course seriously, you are not going to make it through the program. And I've had that happen in the past, unfortunately. There have been students who have kind of just walked through this class. They haven't learned the skills necessary to be successful, and they unfortunately did not make it through the next semester when they started clinical. So please put your time, put your effort, put your energy into this course. This is not another basic course that you're taking. It matters. You also, in terms of being successful in the program, you also have to have great time management. There is such a curve when you're coming into this program. You're used to a Rhode Island College-based course where you can kind of just show up and hope for the best and maybe get extra credit if you're doing poorly. That is not the reality of this course. That is not the reality of this program, and that is not the reality of anything that I teach. So you have to make sure that your time management is precise. Do what works for you. There is going to be some growing pains while you figure that out, but you eventually will figure that out within the first few weeks. Utilize your resources, and I'm not just talking about your textbook. You guys are resources for each other. What you may struggle with, your classmate may really get and may really understand and may have a creative way to learn that material, and vice versa. Learn from each other. Ask the senior students questions. You have a senior representative who can help you with these things. Ask me questions. A lot of students are really afraid to ask me a question because they think that it's stupid. And I promise you, there is no stupid question. You can ask me the same question 5 or 6 times, and I may give you a little eye roll just to bust your chops, but I promise you, we're going to get it. We're going to get you there. If you show me that you want to be here, and even if you're struggling with something and you're just not getting it and it's just not clicking, I will give you the same amount of effort you are giving this program. Also, get involved. We do a lot of great activities, like you can see on this picture here, both pictures to the side. We do a lot of team building events. We do a lot of fundraising. We do have fun throughout the program. We do have little moments where you can take a breath and just relax and say, for a minute. Get involved, be excited. This is something that is going to be a very short period of your life. Every group of students that I've had so far has said at the end of it, wow, I can't believe we were just here last year. It goes by so quickly. When you're in it, it doesn't feel like it's going to go by so quickly. It feels like it's going to be never ending and you're never going to understand it and you're never going to be ready. But I promise you, you will get there and it's going to come faster than you think. So that is it for our first lecture today. We're going to move a little bit more into some specifics as our lectures move on. Please, if you have any questions about any of the material on here, do not hesitate to email me. Email is going to be the best form of contact with me. If I do not respond within 24 hours, please send me a reminder. But please, please, please don't hesitate to ask questions. I want to make sure you understand the material before you have to take a quiz on the material. So I will talk to you guys in our next PowerPoint.